Welcome to the Delingpole with me, James Delingpole. I just want to give you a heads up about this week's incredibly exciting special guest. His name is Dr. John Lee. You may have read him in the Spectator. He's a very distinguished pathologist. He was a consultant with the National Health Service, and he is very sceptical about COVID-19. He thinks it's really not much worse than bad seasonal flu. He thinks the lockdown is a massive overreaction. He also thinks there's very little evidence to suggest that the lockdown has actually made any difference to the course of coronavirus. He's worried about the enormous societal cost caused by the lockdown. He's a fascinating podcast guest. I do hope you'll listen to this podcast. And if you want to hear it now rather than later, please subscribe to my Patreon. You'll get to hear Dr. John Lee and lots of other podcast guests 3 days earlier than you would normally. You also get access to all my extra articles I've been writing, and you get to join a fantastic community of, I call it Cafe Delingpole because the company is fantastic, the coffee is brilliant, and of course I am your lovable proprietor, and why wouldn't you want to support me? Thank you.
And so they want to hide behind the scientists on it. So we have this rather unhealthy and unholy combination of people trying to be cautious. And now that we've got ourselves into this situation, it reminds me of that children's story about the little mouse running around saying the sky is falling, the sky is falling, and all the animals falling around. And then suddenly he points out that the sky isn't falling, and so he gets a bit of a slapping, and they all go away. But when you've convinced yourself and enough other people that the sky is falling, how do you then, stop doing what you think you're doing to stop the sky falling? It's a conundrum, isn't it? I mean, I think there's virtually no chance of a second wave. I think it's pretty clear that this virus was on the wane anyway. Contrary to what was originally said, about 80% of us getting this virus, it looks like 40 to 60% of us already have some resistance to this virus anyway. I think the whole thing about a vaccine is a red herring because it's unlikely that we're ever going to have one. I mean, the Common Cold Research Institute spent 43 years trying to make a vaccine for the common cold and didn't manage it. I think track and trace is unless we want to go down the Chinese model of tracking and traces people's health forever, which is a real massive Big Brother society, which since when do we copy the Chinese in our societal responses? That's extremely worrying, it seems to me, and unthought through because if we're going to track for this disease, if we're going to track for other disease, every time a new virus comes along, every winter, none of this makes sense to me. And the bottom line is the response that we could have taken, and in fact that we could now have taken for the last 6 weeks, is to give people guidance and advice, to say, no, our original idea about this virus was wrong. It's not as bad as we thought it was, but it does affect certain groups of people, certain susceptible groups of people maybe, and so we can give them advice about self-isolating themselves and keeping out of trouble if they think that's worth it. Because you've got to remember that lockdown and social distancing change society in ways that many of us feel is, well, apart from that, is ridiculous and not sustainable. That especially if you're an older person, make life really, why is it worth living? If you can't see your friends, if you can't see your family, if you can't travel, if you can't go on holiday, if you can't go to the cafe, if you can't go to a restaurant, if you can't do all the things that people have earned their money to enjoy in their old age, really, I mean, what's going on? And so I think quality of life. There's more than just death in this conversation. Quality of life is very important.